most of the tray will look very fresh, but the patients are not going to admit that they have not worn it. They'll tell that I cleaned it well, so that's why it's looking very fresh, but they wouldn't have worn it. So that is why when you select a case for the aligners, I told you a lot of points you have to take care. So other than that, you have to make sure that the patient is self-motivated enough and patient will be cooperative enough. Otherwise, how much of a good treatment planning we do, it's not going to work. And after 2 or 3 stages, fitting issues will start coming. The aligners are not going to fit. Then everything will go haywire. Inadvertent movements will start happening. So that is why these points you need to emphasize. Make the patients understand. If the patient is sure enough of being cooperative to the treatment, then only go for the aligner treatment. Otherwise, there's another option. It's not that you will lose the patient. Braces are there. You can resort to that. So that is why this is very important. We see a lot of cases. We see a lot of doctors also, facing a really tough time at the end of the treatment. So that is why this point should be taken care of. Okay. Then chances of breakage is there. So that is where, the materials used for fabricating the aligners play a very important role. So we will discuss about materials in the coming slides. Then forgetful nature of the patients. Patients might just go to have anything, eat from out. They'll misplace the aligners somewhere. They'll go back, they'll miss the aligners. So patient's responsibility on the patient's side is very high, and that is very much detrimental in the success of the treatment. Okay, so any doubts in this? Okay. So now coming on to the biomechanics. So biomechanics is a bit dry, so I'll just give you a bird's eye view since we have already, time limitation, time constraints. I'm not going so much into the detail. So here if you see, this is what happens in braces. So the first wire what we give in conventional braces is a round nitride wire, nickel titanium wire, which has shape memory. And mostly what it does is it pulls the tooth onto the area where we want to align. But in case of aligners, what it does is it's a pushing motion because it's a plastic that is surrounding the tooth. So it's mostly a pushing motion that is happening in case of aligners. So next is factors affecting force system. This is also very important because now due to extensive marketing, when you take YouTube itself, the first video that will pop up will be of some aligner manufacturer. And the other day I was talking to one of my orthodontist colleagues, and what he was telling is when he took Swiggy, it was showing that you get booked for free scan, one of the aligner companies. So that is how things are happening in market. So people know, patients know, but they are mostly often misled. They think like single visit endodontics we tell, no? So nowadays, people think that this is like single visit orthodontics. You go to the clinic, get the trace, and everything will fall into place like a magic wand. No, that is not how it is happening. So whatever we have learned, over the years, the biology of tooth movement, the biomechanics, everything happens here also. So for all that to fall into place, all these factors play a very important role. So first is tooth anatomy. I told you there should be sufficient crown surface area. Then aligner adaptation over the tooth. That is, I was telling before also, that is the most important point. So if you see this figure, from a distance you will not be able to make out that the patient is wearing the aligners. Why? Because the aligners are fitting properly on all the tooth surfaces. But look at this figure. There's a distinct gap between tooth and aligner. So at any point, if you see such a sign, that should be a warning sign for you. You should think that, okay, something is going wrong, something is not going right in the treatment. So at any point, all the aligner should be fitting properly on all the tooth surfaces. That is very important. Okay. And then material stiffness, material quality plays a very important role. Then activation programmed into the aligner. So the activation programmed into each aligner is done by the orthodontist who designs the case. And as experienced practitioners, if you have any specifications, you can give us. So based on that, we can design the case and give. Then auxiliaries or attachments used. Auxiliaries are nothing but the button I was talking about, and attachments are composite blocks that are bonded onto the tooth. So regarding the attachments also, we will discuss about detail in the coming slides. Then duration of wear of the appliance. So duration, many companies tell 22 hours, but again another thing is when the patient wears the aligner, they should make sure that they wear it for a longer span. It's not like you wear it now, take it out for half an hour, keep it aside for 5 to 10 minutes, wear it again after half an hour you take it out. No. If the patient wears it, make sure that the patient wears it for a longer span. This point also, I actually got it out of my experience only because as a person who is interested in a bit of research, I try to do all this. I talk to the patient, I do a very thorough follow-up after I give the aligners. So this point also, one patient was telling he was wearing it for 22 hours, but the 22 hours he was wearing, after every half an hour he is taking it because he was feeling a bit, uncomfortable. So that is not how it has to be worn. Only while eating, they have to take it out, or while drinking any hot or colored beverages, they have to take it out. Otherwise, the aligner should be there in patient's mouth for the entire duration. Okay, so any doubts in these points? Is it clear? I'm trying to keep it as simple as possible. Hope it is important in that way itself.
Adaptation would not be ideal when we start every new
Sir, adaptation, no, adaptation will be ideal.
We want to take it in a decided position that will happen at the end of the.
Yeah, adaptation means that will be very negligible gap because 0.2 mm and not. But I'm talking about this kind of adaptation issues. This is like a huge gap. A little bit of gap that will be there, but you know that if you look at so much keenly, you'll be able to understand because only 0.25 mm or 0.125 to 0.25 mm only per aligner movement we do. So that will be distributed. So that won't be too much of an adaptation issue. So biomechanics, so basically aligner works according to two principles. One is displacement driven concept and one is force driven concept. So displacement driven system means it's also known as shape molding effect. So I'll show you an example. Just imagine the aligner is in the tooth is in this position, and after stage 1 it has to be moved to this position. So I'm exaggerating the movements, okay, for you to understand. Definitely a single stage won't move this much. So how the aligner is made is, it is fabricated according to the anatomy of the position where the tooth has to be moved. So in this position the aligner will be made so that when the patient wears it here, it will push the tooth onto the area where we want. So that is why it is known as shape molding. The aligner, the plastic shape is molded in such a way according to how we want the movement. Okay. But one of the problem with this is it is less effective in controlling the root movement. Only the crown is going to tip. So what will be the drawback in such a case? Relapse. Yes, the stability of the result will not be high. So the chances of relapse will be more. So that is why when you choose an aligner manufacturer, always make sure that they follow the force driven concept. So in force driven system, what happens is we make use of attachments.